So let's talk about some of the heart problems. Specifically, the one I'm thinking of is atrial fibrillation. Now, what does atrial fibrillation mean?
That's where the upper chambers of the heart go out of rhythm. So normally the upper chambers and the lower chambers are coordinated, but the upper chamber goes out of rhythm entirely. It just fibrillates like a bag of worms.
So it's not effectively beating, it's just wiggling sort of thing.
Correct.
When that happens, will that cause a stroke?
Well, blood clots can form in the atria when you have atrial fibrillation. And blood clot can then get out of the heart, be ejected from the heart, and throw a clot to the brain.
Wow. So a common cause of stroke?
Fairly common, up to 20-25% of ischemic strokes.
So if people feel a fluttering of their heart, or it flutters, could that be an indication that it could be the beginning, or they could really have atrial fibrillation and not really know it?
It's a possibility. Oftentimes, just irregular heartbeats, the rhythm is normal, but a person has extra heartbeats. However, we want to be alert to atrial fibrillation where it is irregular all the time.
So if it's irregular all the time and you get a blood clot and you could throw it to the brain, how do you know whether they're having it half the time or not? What can you do? Do they usually have it for a minute, or do they usually have it for 12 hours?
Well, the natural history of atrial fibrillation is that it is an occasional event that becomes more common and more common until they're in atrial fibrillation all the time. So it really requires some monitoring and a visit with a physician, usually a cardiologist or a primary care physician, to monitor the heart.